So where I'm sitting now is in Heidelberg Heights, and it's about a minute or 2 minutes drive to the Austin Hospital from here, and very close to the Box Hill Hospital and in the postcode of where our last outbreak occurred. And I remember Daniel Andrews using that term, our Victorian Premier, that we had to have a cautious pause before we came out of lockdown. And then we did it. We did our double donut days, and we're still doing them. But this was the hot spot, the last hot spot after the outbreak from Box Hill Hospital. God knows why it happened in a hospital. So that also gave me a lot of trepidation and fear about coming back, because I was coming into a suburb that had cases of COVID. Fortunately today they're undertaking a mass screening again, which is great. So many people have turned up, even if they're asymptomatic, to get tested for COVID. So here I am. I've got one patient today face-to-face, 2 interstate patients that I'll see via telehealth for a long time, and somebody who is quite elderly and frail and survived thunderstorm asthma, and for cases like her, telehealth has been an absolute godsend because she's so lonely and isolated, and I can keep looking after her. So that's me and my clinic, and I'll show you around a little bit. Over here you can see my life as it was for the past 7 months on Zoom. It was awful, absolutely awful. Although I can't be more grateful to the Australian government for making it available to doctors. It certainly saved our lives. It certainly made sure that we could keep up to scratch and in touch with our patients, but boy was it hard. And I have so many memories still of days of bleak winters and homeschooling and hiding up the front of the house in the entrance hall with no natural light, and having backdrops so people couldn't see where I lived, and having patient after patient who I knew really well, and wondering, are they getting worse because of COVID and being in lockdown, or are they actually developing something I need to manage actively? And feeling so helpless, absolutely so helpless. Because a lot of psychiatry, and people don't understand this, is about meaningful connections and being present. And being present via screens just doesn't cut it. It doesn't cut it at all. I feel in some ways like an imposter. I feel in some ways like I shouldn't whinge. It kind of feels to me like the people on the front line with COVID, our anaesthetists, our ICU physicians, our ED doctors, our GPs, if someone presented with suspected COVID, they'd jump in and do something. Our med-reg is the same, all our poor DITs, medical students, anyone on the COVID wards or non-COVID wards who are actively fighting the COVID fight. They were gowned up in PPE for hours at a time, not eating or drinking or going to the toilet, and it's still that way for many doctors. But here was I, sitting at home with a screen, and I've been a psychiatrist for nearly 10 years, and I just didn't know what I was doing. And I kind of felt it was really hard. It was so hard to show empathy or reach out. I felt completely helpless a lot of the time. I spoke to a colleague who said that he had an enormous sense of demoralisation through this period, and actually wondered if his patients were worse for having ongoing therapy via telehealth. It was awful to sit with patients that I knew really, really well who were crying beside themselves. One beautiful one at the start of the pandemic who thought they'd be relegated to a regional post with no support for the rest of the year, when our health department wondered if it might be a good idea to keep doctors frozen in posts. I watched her lose 10 kilos on the screen of weight. I could see it. It was that profound that I could see it on a Zoom screen. Another beautiful doctor that was furloughed and was so lonely and full of despair, and someone I knew really, really well. And I'm thinking, is this their normal bout of depression they get about every time this year? Is this something different? What do I do? Yeah, I can e-fax a script or pharmacy just so they can tell me they've lost it or they never received it. Thanks very much, Chemist Warehouse. Great big shout out to you. You've been so helpful. Not. But however, I was there. I turned up every time for them, and they say they're grateful. But now I've got this new dilemma. I run an after hours clinic for doctors, And it's really because I want to be accessible and I want to be able to do face-to-face. And I'm finding that doctors are really reluctant to come back. Some are really happy to, and I've had some wonderful moments where people have jumped through the door and, you know, feel like it's all fantastic, you know, hand sanitizer everywhere, masks, a whole lot, social distancing, but still a reality that meant something to us. It was familiar again. And then I've got all these other doctors that are like, well, can't I just keep seeing you on telehealth because I can slot it into my busy work day, I don't have to drive to see you. I can see you more often because I can see you during a working day. And I think, no, because it's not fair on me and it's not fair on you. But I don't know how to deliver that message, and I'm really kind of fearing, and I'm sure the GP population are too, that people aren't going to understand the true enormous value of what we do face to face, and they're going to think they can get away with it on a screen, and I'm really worried about that. So I'm hoping that we can start having a conversation about how to re-educate people, all people, to come back, but especially doctors. You know, as I said, I run this after-hours clinic for a reason. I try and be as flexible as possible. I run Saturday sessions, I run Thursday night sessions, and I miss everyone, and I can't gauge how they're going unless they come back. So there's just some thoughts that I've had sitting here on what is absolutely such a beautiful day in Melbourne, except for the typical north wind. Can't always have it completely right. And I'm reflecting before my first patient arrives today, face to face, and I'm really excited to be seeing her again. She's had a really, really tough time. And yeah, like so many of the doctors that I'm seeing, this pandemic of mental illness, hey, we've not reached the peak and people aren't talking about it. And I'd really like to know where all that funding's going for mental health and doctors, because I'm not seeing it. Not that I personally want it, but I don't see anything tangible, and I'm not seeing real conversations about how bloody awful it is to spend the whole day in PPE, or to be a GP isolated at home on telehealth, or a medical student who can't get through their placements, they're moved around, they're sent home, they're sent back, they're trying to learn medicine on Zoom. They're terrified that they're going to become incredibly poor doctors next year, and they haven't had a fair chance. Our doctors in training population who have had their whole years decimated by exam changes and muck-ups, and when they've put their life on hold. There's so much work still to be done, and it's wonderful that we can start doing it again face-to-face because of the vigilance that we've had in places such as Victoria. And I'm really proud that I am a Victorian, and yes, it was absolutely dreadful to be in lockdown, but hey, to have double digits and to get out of this mess and hopefully be better prepared. I'll do it all over again if I have to, and I really don't want to have to, but the sentiment of that is the suffering that I endured was nothing like the suffering that many people have endured. But we can't keep going like this. People have to come back to the doctors so that we can start working out where we're at right now and get a sense of how things are for you. So yeah, there's just some of my thoughts I've been having, and a really open disclosure that coming back to the office was really, really scary, and I still don't know why, because it's such a beautiful space. And I don't know, I've dragged my things in, I've got away from my Zoom for a while, well, until midday today when I see someone interstate. But yeah, please come back. Let's get started again. Let's get some work done, because we all need it. It has not been without severe consequences being in lockdown and being on the front line, and I can't stress enough, whether you get told this is just normal in a pandemic, what's normal? Who cares? If you can't sleep, if you're distressed, if you can't stop thinking about things, if you've been traumatised by something you've seen at work, if you've had no time to literally go to the toilet for 12 hours, you kind of need someone to talk to. So whoever it might be, your GP, your psychologist, people that get it, people that are in our profession that actually get it. So friends kind of get it, but I don't think people really understand what it's like to be a doctor and be so frightened and waiting for multiple COVID test results and going backwards and forwards, and hospitals giving them mixed messages and daily updates on changes in procedure and being furloughed or missing exams. There's a lot to process there.